I was overhearing at a conference someone from one of the big cancer centers just saying, "Oh, we use MRD for everything all the time." Right? It's just become I'm treating a cancer patient. Why wouldn't I want to constantly know the level of circulating tumor DNA in the thing? So to them, it's like, in a sense, and this is, of course, the big plan, does it replace or substitute or have a different role or an earlier role than scans, which obviously were the standard of care for the longest time? And that's the big tension debate that's going on right now. If because it's not well written yet, it's still new in the medical sense, that the guidelines are written around cancers being detected in scans. And so if an MRD, you get a positive hit, there's not necessarily a set of directions on what to do, which is why often they're reluctant right now. Again, it's getting prescribed all the time in a big mainland cancer center, advanced cancer center, but much less so for the community oncologist, because he or she doesn't have a specific, in a lot of cases, a specific set of actions to take for something as broad as breast cancer, right? It's just kind of the unknown. It's not clear what to do if you get a positive MRD to the doc, and it's not clear what to do if you get a negative MRD. It's information, but it's information. It has one value, which is if the patient is clear and you get to convey it to the patient, it makes the patient super happy. That's a nice thing, right? Nobody thinks that's a negative. But does that mean you can take the low level of chemotherapy that you've got that patient on just in case, and they hate it because they want to be feeling better? They're immediately going to go, well, if there's no cancer, why do I have to take this horrible thing, right? So now you've started a whole set of questions down there. If you get a no cancer test, and if you get a cancer detected test, if it doesn't say in the NCCN guidelines what I should do, what's my liability, right? I can't do nothing. Or maybe I do. Maybe my liability is I need to wait until I see it on a scan, because then I know what to do with this patient. But right now, maybe I'll do more scans. And some doctors, I've seen very frustrated execs in MRD companies go, some doctors just won't take an action until it's on the scan, even if they get a positive MRD test back.